Today we have one new case of Covid-19 to report in managed isolation. It's now been 76 days since we had a case of Covid-19 acquired locally from an unknown source. Today's case is a child of two people, both of whom have previously been reported as cases. They arrived in New Zealand from Italy on the 4th of July, and that family is staying in the Commodore Hotel in Christchurch. And I just wanted to pause there to wish the family a full and speedy recovery, and likewise to all our people who have active COVID infection at the moment. We shouldn't forget that these are Kiwis, and they have got this disease, and we do want them to recover well and fully, and know that our thoughts and best wishes are with them. We've had a further case be classified as recovered, so our number of active cases actually remains at 27 in total at the moment. Our total confirmed cases is now 1,198, and we will update the WHO on that number. And there is no one receiving hospital level care at the moment. Yesterday we did see an increase in testing, a total of 2,899 tests, of which 726 were undertaken at our managed isolation quarantine facilities. So our total number of tests now completed is 436,233. We've seen some reports on social media about people being concerned about being charging for tests, and just to reiterate the point I made a couple of days ago, there is no cost for an individual to be tested for Covid-19. We have negotiated an agreement with the district health boards and with primary care for GPs and the CBAC staff to be reimbursed. So anyone wanting advice about whether they should get a test should ring Healthline, their own DHB, or of course their own GP. Just to follow on from the Minister's opening comments about the COVID Tracer app, great to see that increase in registrations yesterday. It'd be good to see that continue. The number of QR codes on display is also continually increasing, up to 78,810 now, but still a number of businesses and organisations that haven't yet got on board. I know that a lot of businesses did try to get their QR code in May and found the process overly complex. It's important for them to know that it is now a much simpler process, and it only takes a few minutes. All you need is a driver's licence, and if you don't have a driver's licence, you can still get one by completing a simple template and emailing it to the Ministry. So check on the Ministry of Health website. And just to reiterate that the NZ COVID Tracer app and any of the similar apps that are being used in other countries, and we've seen this in Australia over recent days with their outbreaks in Victoria and then the smaller outbreak in New South Wales. The app is an adjunct to having a really good contact tracing system in place, which is what we have been working on here in New Zealand. So interestingly, if you look in Australia, they are reporting that they've downloaded information from their Bluetooth-based app as of a couple of days ago, 285 people. They didn't identify any additional contacts through that download, and likewise about a dozen downloads of the information from the New South Wales outbreak and didn't identify any additional contacts. However, the value of both the app we have and the Bluetooth functionality, which we are looking to add to our app in due course, on that Apple Google platform, the value is in being able to notify people rapidly so that they can take action with either self-isolation and or getting advice about a test. So again, just a final word of encouragement of people to download the app, use it to scan. It only takes a few seconds each time you enter a premise, and that will be very helpful with our preparation, which we must all be a part of, for the likelihood of getting a community case at some point in New Zealand. Thanks, Minister.
Thank you. Just briefly before we get into your questions, a brief update on behalf of Dr Woods and the MIQ team. Yesterday, you'll be aware that around 3:30 p.m. a fire alarm went off at the Ridges, a managed isolation facility. It was accidentally triggered whilst furniture was being moved. Fire and Emergency New Zealand responded, and the returnees were safely evacuated to the designated assembly point whilst also being asked to follow social distancing rules. Due to the large number of people evacuating from the 3 exits, there was a short time where social distancing could not be strictly followed, but the health risk is considered to be low because the returnees were wearing masks as they do when they're outside their rooms, and any contact closer than 2 metres would have been for only a short period of time. There were 154 returnees staying at the Ridges, and all have had negative day 3 tests. There has been no positive test at the Ridges for more than 3 weeks. Routine day 12 testing, of course, will still be undertaken. Facility staff saw no evidence of bubble breaking or mingling with the public when the returnees were evacuated. They were cleared for re-entry 20 minutes after the fire alarm at 3:50, and re-entry was completed at 4:30 p.m.